Hi everyone, this is Walid Youssef. In this video, I will go over hyperkalemia. So let's get started. I'm going to give you an overview over things that you need to know in NCLEX exam, Prometric, and HAD exam or other exam. I will hit the high point to make sure you understand it. Are you ready? Here we go. So, what do we mean by hyperkalemia? Hyper mean increasing. So, meaning of hyperkalemia is excessive potassium in the blood. So, if we ask ourselves what is the normal potassium level in our blood, the normal potassium level is from 3.5 to 5 milliequivalent per liter. Usually this number it may differ from one reference to another reference, but this is the general reference over many books or lab limits. Any potassium level higher than 7 is very dangerous and it needs immediate intervention. So most of our potassium is found in the intracellular or inside the cell, whereas the sodium is more in the extracellular fluid. So when we do blood test for the patient, we are measuring the potassium in the outside of the cell in the extracellular fluid. So if you ask ourselves, what is the importance of potassium? Potassium is very important. It's responsible for nerve conduction and in muscle contraction. So if we ask ourselves what is the causes of hyperkalemia, if you want to remind the cause of hyperkalemia, remember the phrase, the body cared too much about potassium. The first cause of hyperkalemia is cellular movement of potassium from intracellular to extracellular, and this it will happen in pain if a patient has pains, tissue damage or acidosis. The second cause is adrenal insufficiency with Addison disease. The third cause is renal failure because our body is unable to excrete the potassium through the renal. The fourth cause is excessive potassium intake through the food, drug, etc. The last cause of hyperkalemia is drug related. Some drugs it will cause hyperkalemia. An example for that, potassium sparing drugs such as aldactone, ACE inhibitor and non-steroidal anti-inflammatory drug. So, what is the sign and symptoms of hyperkalemia? If we ask ourselves, what is the signs could I see on the patient with hyperkalemia? So again, remember the word murder. Murder, it will give you a hint to remember the sign and symptoms of hyperkalemia. So murder is stand for M, muscle weakness, urine production little, especially with renal failure, respiratory failure due to increased ability to breathing, to use a breathing muscle, or if the patient has seizure, developing a seizure, decreased cardiac contractility, patient may have weak pulse, low blood pressure, early sign of muscle twitch, cramps, and at the later stage we'll found patient has profound weakness and flaccid, and the last sign and symptoms is rhythm change or ECG changes. In ECG we may see tall T wave, flat P wave, widening QRS and prolonged PR interval. So what is the nursing intervention for patient with hyperkalemia? One of the most nursing intervention for patient with hyperkalemia is frequently monitoring the potassium level. Our doctor may order us to check serum potassium every 4 hours, every 6 hours, etc. to have a continuous follow up on the potassium level in our body. The second intervention is monitor ECG changes. As we said before, the patient we have with hyperkalemia may have some ECG changes, so we have to keep an eye on it. Monitor intake and output, especially with patient with renal impairment, because as we said before, if the patient has renal failure, he may be at risk of hyperkalemia. If your patient is an IV potassium and oral potassium, for sure we have to stop them because both of them will cause increasing potassium in our body and hyperkalemia. Diet play a major role, an important role in hyperkalemia. So we have to initiate potassium restricted diet. Also, we have to remember the most rich food with potassium and to do food adjustment to prevent that. If we want to remember the food rich in potassium, we have to remember the word of potassium. Potassium is summarizing for us the rich food in potassium. Those food are potatoes, orange, tomato, avocado, strawberry, spinach, fish, mushroom, muskmelon, and also carrot and banana. So again, one of the most nursing intervention, dialysis, if hyperkalemia is severe. Dialysis is the most effective intervention in patient with severe hyperkalemia. No any intervention work else than dialysis in patient with severe hyperkalemia. Administer coagulate orally or per rectum. What is the function of coagulate? Coagulate, it causes exchange sodium for potassium in the GI tract, and the body will excrete potassium through the stool. Doctor also may order potassium wasting drugs like Lasix and hydrochlorothiazide, because Lasix, it will cause too much diuresis, and as we said before, our body will excrete potassium through the urine. The last intervention, administer hypertonic solution of glucose and regular insulin to pull potassium into the cell. Doctors found that if we give patient dextrose with insulin, especially the insulin, it will cause pulling the potassium into the cell, and this is one of the common intervention for patient with hyperkalemia. So at the end of this video, I need you to write an answer for this question in the comments below this video. So if a patient has a potassium level of 9, which nursing intervention is priority? Remember the word priority. A. Prepare the patient for dialysis and place the patient on a cardiac monitor. B. Administer spironolactone or aldactone. C. Place patient on potassium restrictive diet. D. Administer a laxative. I'm waiting your answer. So at the end of this video, please don't forget to like, subscribe, and share our channel. With me in coming video. See you soon. Bye.